Hello. Today I would like to talk about Florence Nightingale, a pioneering figure in modern nursing and healthcare reform. Her groundbreaking work laid the foundation for the nursing profession as we know it today. Let's know it. Florence Nightingale, born on May 12, 1820, in Florence, Italy, is known as the founder of modern nursing. Her work revolutionized healthcare and laid the foundation for the professionalization of nursing. She was born into a wealthy British family, and her early life was marked by privilege. Despite her family's expectations for her to marry, Florence felt a strong calling to serve others, particularly in the field of healthcare. At the age of 24, Nightingale's interest in nursing began to develop, although nursing at the time was not seen as a respectable profession. She trained in Germany at the Kaiser-Werth Institute for Nursing, where she gained valuable medical knowledge. Florence Nightingale's career took a pivotal turn when she became the superintendent of the Institution for the Care of Sick Gentlewomen in London in 1853. However, it was her role during the Crimean War that truly defined her legacy. In 1854, during the Crimean War, she was sent to a British Army hospital in Scutari, where conditions were dire. Soldiers were suffering from preventable diseases, and the hospital was overcrowded, unsanitary, and poorly managed. Upon arrival, Nightingale observed the unsanitary conditions and realized the importance of hygiene in preventing the spread of disease. She set about making improvements, focusing on cleaning, ventilation, and proper waste disposal. Nightingale worked tirelessly to provide care to the wounded and sick, often working long hours during the night, which earned her the nickname the Lady with the Lamp. She would walk through the wards at night, checking on patients and offering comfort. Her efforts in the Crimean War resulted in a significant reduction in the death rate at the hospital, from 42% to 2%. Her work demonstrated the importance of sanitary conditions in preventing infection and saving lives. Nightingale's success in improving hospital conditions earned her widespread recognition. After returning to England in 1856, she used her newfound fame to advocate for healthcare reform. In 1860, Florence Nightingale established the Nightingale Training School for Nurses at St. Thomas Hospital in London. This was the first professional training school for nurses, which helped elevate nursing as a respected career. She also developed a curriculum for nursing education that focused on hygiene, sanitation, and patient care, setting the standard for modern nursing practices. Her educational efforts led to the establishment of nursing schools worldwide. Nightingale's influence extended beyond nursing. She was a pioneering statistician and used data and evidence to advocate for health reforms. She famously used pie charts and other visual tools to present data on hospital conditions, making complex information accessible. She was one of the first to emphasize the importance of statistics in healthcare, showing that poor sanitary conditions led to higher mortality rates. Her work in statistical analysis laid the groundwork for evidence-based healthcare practices. Florence Nightingale's contributions were not limited to nursing and healthcare. She was a strong advocate for women's rights and believed that women had a vital role to play in society, especially in fields like nursing and healthcare. Her advocacy for women's participation in nursing led to the professionalization of the field. She believed that nursing should be an educated, skilled profession, not a job reserved for women of lower classes. In addition to her work in healthcare, Nightingale was a prolific writer. Her most famous work, Notes on Nursing, What It Is and What It Is Not, published in 1859, became an essential guide for nurses worldwide. She also wrote extensively on the principles of public health, sanitation, and hospital management. Her writings influenced both the development of healthcare systems and the education of future generations of nurses. Nightingale's efforts were not without resistance. At the time, many doctors and medical professionals were resistant to her ideas about hygiene and sanitation. However, her data-driven approach helped to convince them of the importance of her reforms. Throughout her life, Florence Nightingale remained committed to improving public health and nursing. Despite health challenges of her own, including chronic illness, she continued to work for healthcare reform well into her later years. In 1883, She was awarded the Royal Red Cross by Queen Victoria for her service during the Crimean War. In 1907, she became the first woman to be awarded the Order of Merit by the British government. Florence Nightingale's legacy continues to inspire the field of nursing today. Her work in healthcare reform, nursing education, and public health remains a cornerstone of modern medical practice. The Nightingale Pledge, which was written in 1893, is still recited by many nurses today, reflecting her enduring influence on the profession. It emphasizes ethical standards, patient care, and the commitment to improving healthcare. Her influence also spread globally, and her work in establishing nursing schools led to the creation of nursing programs in countries across the world. Her impact is felt in healthcare systems across the globe. Florence Nightingale's achievements were recognized with numerous honors during her lifetime, but she remained humble about her accomplishments. She always emphasized the importance of the collective work of a nursing profession rather than focusing on herself. Nightingale's legacy goes beyond her own time. She was a key figure in the development of modern healthcare systems, and her contributions to public health, hygiene, and nursing education are still seen in practices today. Her work contributed to a paradigm shift in healthcare, highlighting the importance of sanitation, data, and education in improving patient outcomes. This focus on evidence-based practice continues to shape the way healthcare is delivered around the world. Florence Nightingale's contributions were vast and transformative. Her life's work has left an indelible mark on the world, and her contributions to nursing and healthcare reform are as relevant today as they were over a century ago. Today, Nightingale's memory is honored worldwide, and her contributions to nursing, public health, and healthcare reform are still celebrated. She remains a symbol of dedication, compassion, and the transformative power of healthcare. In recognition of her groundbreaking work, International Nurses Day is celebrated each year on her birthday, May 12th. This day serves as a reminder of her tireless dedication to improving healthcare and the role of nurses in society. Florence Nightingale's vision and achievements continue to inspire generations of healthcare professionals. Her life's work has left an indelible mark on the world, and her contributions to nursing and healthcare reform are as relevant today as they were over a century ago.